Doctor, we were speaking of the skin before? Yes, we were. And a cicatrix is what? A cicatrix is a scar. And a cicatrix of the skin is due to what? It can be due to a burn, such as structures beneath the skin, which are also undamaged. And what is the operation of choice? It is an excision of a cicatricial skin lesion. Does that employ the use of split thickness or full thickness skin graft? Yes, it does. It is the removal of excess scar tissue and replacement by covering the area with either half or full thickness of the skin removed by a knife or dermatome. Doctor, the skin of the neck, chin, or cheek is the same? Yes, it is. It is a contracture from scar of old burns or injuries or cicatrices. Doctor, what is the reconstruction operation that is of choice? Well, it is a skin and subcutaneous tissue from donor area applied in the pedicle, which is tubed. And doctor, the preparation of the pedicle or Gillies tube flap is used? Yes, it is. Is there an excision of the scar? Yes, of the cicatrix. Doctor, what about the removal of the pedicle? Yes, the pedicle is opened and returned to the donor area. Doctor, is the skin of the axilla also involved? In this case, it is a cicatricial contracture of the axilla. And is that done by a Z-plasty? Yes, a Z-plasty, which is correcting a defect by using sliding flaps of skin. Doctor, an abscess of the breast due to Staphylococcus aureus or other infectious agents is treated how? It is treated by a mastotomy with drainage. There is a surgical opening and evacuation of the abscess, as well as the insertion of a drain. And doctor, that is a carcinoma? It is a radical mastectomy to correct that, yes. Doctor, what about a unilateral hypomastia? A unilateral hypomastia is approached by the augmentation of a mammoplasty of the underdeveloped breast. Doctor, does hypermastia of the contralateral breast result in a reduction of the overly developed breast? Well, an implantation of a Cronin silicone prosthesis in a retromammary pocket is the operation of choice. There is a partial excision of mammary tissue and a high fixation of the mammary. Doctor, tell us about the osseous tissue of the bone surrounding this area. Well, the hardest type of connective tissue which provides a supporting framework for the body is the bone marrow or medulla. It is a soft central part of the bone. Doctor, is that red or yellow? It is red marrow which fills cancellous bone and manufactures red blood cells and hemoglobin. Doctor, what about yellow marrow? Yellow marrow fills the medullary cavity and contains fat cells. The cancellous bone, doctor, is what? That is a spongy bone composed of a loose lattice work of bony trabeculae and bone marrow within the interspace. Is there compact bone present, doctor? Yes, the cortex of the bone is a solid bone rich in calcium. What about the diaphysis? The diaphysis or shaft of the large bone or long bone should be a spongy bone between the two tables of the skull, for instance. And the endosteum? The endosteum is the membrane lining the walls of the medullary cavity. And the epiphysis or epiphyseal area? That is an extremity of long bones and the center of ossification for growing bone. Doctor, the matrix of the bone is what? That is the collagenous fibers and a ground substance in which calcium is deposited. Is that called the medullary cavity, doctor? The marrow-filled cavity within the shaft of long bones. What is ossification, doctor? Can you tell us? It is bone formation. And osteoblasts? Osteoblasts are bone-forming cells. And osteoclasts? Osteoclasts are bone-absorbing cells. And osteocytes? Osteocytes are bone cells lying in lacunae within the intercellular substances. Doctor, what is an osteoid area? That is a calcifiable osseous tissue, yet uncalcified. What is the periosteum? The periosteum is the outer covering of the bone. And trabeculae? Trabeculae is the slender spicules or anastomosing bars of spongy bone. Doctor, the trochanter is what? The trochanter is the bony prominence of the upper extremity of the femur below the femoral neck. Is it major or minor? The major or greater trochanter is the large bony projection located externally and laterally between femoral neck and shaft. What about the minor or lesser trochanter? The minor or lesser trochanter is the conical bony prominence located medially and laterally at the